Hey everyone, and welcome to The Explainer. If you've ever had to deal with a deeply painful, just drawn out loss of mobility in your arm, you know firsthand how incredibly frustrating and honestly how exhausting it can be. Today, we're literally unlocking the mystery of frozen shoulder. Picture this. You're sitting in your car, you reach back to grab your seatbelts, or maybe you're just putting your arm through a regular coat sleeve, and bam, you feel this sudden, sharp, agonizing pain. No way around it. It hurts. That sudden and frankly really frightening loss of motion, that's often the very first warning sign of this condition. We're not talking about a minor tweak here or a typical muscle strain. It is a profound locking down of the joint that can completely upend your daily life. But don't worry, because understanding exactly what's going on is absolutely the first step toward getting some relief. So here's our roadmap for today's explainer. Number 1, what is frozen shoulder? Number 2, who is at risk? Number 3, the 3 distinct stages. Number 4, surviving the nighttime pain. And finally, number 5, your diagnosis and treatment options. All right, let's jump right in. Section 1, what is frozen shoulder? The mechanics of the joint capsule. So while everyone calls it frozen shoulder, the actual clinical term is adhesive capsulitis. Think about the strong connective tissue surrounding your shoulder joint as kind of like a flexible envelope. Well, in adhesive capsulitis, this envelope becomes severely inflamed. It gets thick and it gets super stiff with these tight bands of scar tissue called adhesions. Plus, there's actually less synovial fluid available to lubricate the joint. So it essentially acts like a tight, inflamed straitjacket, firmly locking that ball and socket joint in place, which is exactly why your shoulder feels quite literally frozen. And this becomes super clear when you visit a doctor for a diagnosis. They're going to test 2 things. First, active range of motion. That's when you try to move your own arm. And second, passive range of motion, which is when the doctor tries to move your arm while you let it completely relax. Now, unlike a simple muscle strain or, say, a mild rotator cuff tear, where a doctor can usually still lift your relaxed arm for you, with a frozen shoulder, both active and passive motion are painfully restricted. The joint itself is physically locked up by that scar tissue. Moving on to Section 2, who is at risk? Demographics and risk factors. You might actually be surprised to learn that an estimated 2 to 5% of the general population will experience this condition at some point in their lives. That is a lot of people. And interestingly enough, it very frequently targets your non-dominant arm. So who exactly makes up that 2 to 5%? Well, adults between the ages of 40 and 60 are the primary demographic here, with women being affected slightly more often than men, about a 1.4 to 1 ratio. But the really crucial point to take away is how systemic issues dramatically increase your risk. For instance, it affects anywhere from 10 to 20% of diabetic patients. It's also closely linked to thyroid disorders. And on top of that, if you've recently had to keep your shoulder completely still for a long time, say you were in a sling after a fracture or a surgery, that prolonged immobilization is a major, major trigger. Let's look at how this progresses. Section 3, the 3 distinct stages. A specific, drawn-out timeline. Frozen shoulder maps out into a very chronological, albeit slow, journey. First up, we have the freezing phase. This can last anywhere from 2 to 9 agonizing months. It's marked by severe, diffuse pain that actively gets worse, especially at night, all while your range of motion slowly drops. Then you enter the frozen phase, which lasts about 4 to 12 months. Now, the pain might actually start to ease up a bit here, but the joint becomes highly rigid. Just doing everyday tasks becomes a massive chore. But finally, you reach the thawing phase, lasting from 6 up to 24 months. This is where you finally see a gradual return of your mobility and a real reduction in pain. It is a long journey for sure, but there is absolute hope in that thawing phase. And I really want to emphasize this reassuring medical truth coming straight from the Cleveland Clinic. They say, even left completely untreated, range of motion and use of your shoulder continue to get better on their own. Full or nearly full recovery is seen after about 2 years. So yeah, while the timeline is incredibly frustrating, the condition is largely self-limiting. That means your body eventually heals itself, giving you a highly favorable long-term prognosis. Which brings us to Section 4, surviving the nighttime pain, why sleep is so difficult and how to get it. Look, knowing it'll heal in a year or 2 doesn't really help you sleep tonight, right? Ask literally any sufferer what the absolute worst part of this condition is, and they will almost always say the sleepless nights. So why does the pain become so excruciating the very moment you try to get some rest? Let's pivot into the biological mechanics behind this night pain, because it is a massive source of physical and mental exhaustion for patients. The underlying biology of what's keeping you awake is actually super fascinating. When you go to sleep, your body naturally slows down its blood flow, and your kidneys filter less water. Well, this leads to a state of generalized overnight water retention. And that extra water actively increases the internal physical pressure throughout your entire body. So that shoulder capsule we talked about earlier, the one that is already inflamed, thickened, and incredibly sensitive, it suddenly becomes highly pressurized. That biological pressure spike is exactly what causes that throbbing, intense pain right when you're trying to drift off. Okay, so how do we combat this? Here are some actionable, source-backed strategies to physically support the shoulder and avoid waking up in a jolt of pain. First, try sleeping on your back with your arms extended straight down at your sides. This allows for ideal spine alignment. If you can't get comfortable doing that, lie on your unaffected side. Crucially, though, use extra pillows. Support the elbow of your affected arm with a pillow so gravity isn't just pulling down on the joint all night. Or, better yet, hug a body pillow. This keeps the shoulder joint perfectly stable and physically blocks you from accidentally rolling onto that bad shoulder in the middle of the night. And finally, Section 5, Diagnosis and Treatment Options. From conservative care to surgical interventions. Beyond just surviving the night, what can you and your doctor actually do to speed up the thawing process and get your life back? Well, there's a clear escalation of treatments here. Doctors almost always start with conservative care. NSAIDs like ibuprofen to manage the inflammation, hot and cold compresses, and critically, physical therapy to maintain whatever mobility you still have. If those aren't cutting it, we step up to intermediate options, like corticosteroid injections placed directly into the joint to aggressively knock out swelling, or TENS nerve stimulation to block the pain signals. Finally, for incredibly stubborn cases, we're talking ones that just don't improve after a year or more, there are invasive surgical options. These include manipulation under anesthesia, where the doctor physically moves the shoulder to stretch the capsule while you sleep, or an arthroscopic capsular release, where they use tiny instruments to actually cut through those tight bands of scar tissue. But I want to leave you with this really encouraging statistic. Approximately 80% of patients regain normal or near normal shoulder function with early and appropriate management. Early intervention, especially working with a physical therapist, is just incredibly important, mostly because it prevents secondary issues like muscle wasting from simply not using the arm. Which brings us to our final thought for the day. While we know the thawing process undeniably takes a whole lot of time and patience, what supportive steps are you going to take tonight to finally reclaim your sleep and actively start healing? Whether it's grabbing an extra body pillow right now or picking up the phone to schedule that physical therapy appointment tomorrow, you have the power to actively manage this condition. Thanks so much for joining me on this explainer, and hey, here's to a swift and complete thawing of your shoulder.